What IDH is normal IDH, or normal isocitrate dehydrogenase. What that is everyone who's a physician knows, is a part of the Krebs cycle, which helps produce energy for cells. When you have a mutation in IDH1 or IDH2, and today we discussed IDH2, what happens is that those cells are unable to, the cells with the mutation are unable to turn into healthy adult neutrophils or infection-fighting cells. So what happens is that you get these immature blood cells crowding your bone marrow, and that's what leukemia is. Leukemia is when you have immaturity of the blood cells that crowd the bone marrow, and they're unable to differentiate into normal, healthy adult cells.
Right, now what is AG221?
So AG221 is used to block this mutant enzyme. And you think that if you block this mutant enzyme, what we can do is we can cause those immature cells to be reprogrammed and to mature into healthy adult neutrophils. This is a very different way of thinking about treating cancer. Traditionally, treating cancer was killing cells. Now what we're doing is we're trying to transform cancer cells into healthy adult cells.
So it's a form of differentiation
Correct,
therapy.
A form of differentiation therapy.
And
that is correct.
what did you do in the study then? How many patients have you looked at? And what happened?
So there have been 73 patients enrolled in the study as of October 1st, 2014. There are 45 patients who we can evaluate for efficacy, meaning that they had a bone marrow biopsy at day 28. Of those, 25 of the 45 patients had some sort of response, either a complete remission or a partial remission. Actually, 15 had a complete remission or a complete remission with incomplete blood count recovery, and 10 had a partial remission for an overall response rate of 56%.
It sounds good. Now, how does that compare with historical controls for this particular group of patients?
Much, much better. Unfortunately, patients with relapsed and refractory AML, their survival is usually measured in weeks to months. We have many patients on this trial who've been on this treatment for over 6 months with minimal to no toxicity at all. So we're very, very excited about the treatment.
It sounds almost too good to be true.
Well, it is an interim analysis of a phase 1 trial, so I try to be a little cautious in what I say. But I would think that if this data holds up, I think it'll be a real revolution in the way we treat AML in patients with IDH2 mutations.
Now, the thing about differentiation therapy is you avoid chemotherapy.
Correct.
Are there advantages in that?
Absolutely. I mean, the chemotherapy that we give now lands people in the hospital. It causes them to have low blood counts, which they already have, but it causes those low blood counts to persist for a longer period of time. They're susceptible to infections. When you have a treatment that can cause differentiation and the blood counts beautifully come up, it can really, it's amazing.
But it's a powerful drug, so were there toxicities?
You know, the toxicities were minimal. The toxicities that we've seen are really common toxicities that we see in all patients with AML. So the most common were fatigue, a little bit of nausea, and some fevers. Nothing that has been directly related to the drug itself.
What do you think doctors should be making of the results right now?
Well, I think the doctors should be very excited, because I think that we should wait to see how the completion of the phase 1 trial turns out. But I think that if this pans out, I think this may be, not only would it be a treatment for IDH2 mutant hematologic malignancies, but one has to think about whether we can find other agents that can cause differentiation in other subtypes of AML.
And there are other IDH mutations too, aren't there?
Correct.
So you could apply the principle.
Correct. There's a mutation in IDH1, and there's actually an ongoing trial of an IDH1 inhibitor that started a number of months ago. Those results were presented actually at the EORTC conference, showing, at least in the very, very early phase of the trial, there were only about, I think, 10 patients presented, it showed similar effects.
Meanwhile, your oral differentiation agent has proved quite interesting, to say the least. If your hopes were fulfilled, what could potentially be the clinical applications?
It's very early, so it's hard to, I don't want to lay down my nickel too early, but I would say that if this pans out and if the trial keeps going the way it is now, what I'd like to see is that we could potentially cure AML with IDH2 mutations with an oral treatment in and of itself, or in combination with a little bit of chemotherapy. So we'll have to see how it pans out.
Take-home message in just a couple of words for doctors.
The take-home message is this is an extremely exciting new therapy. It's a wonderful differentiation therapy. It seems to have enormous activity that appears to be durable. For responses have been up to 8.5 months. And that stay tuned. We'll see what happens at the end of the trial.